This is the scapula of the dog. The main important and the differentiating points of the scapula of the dog is the scapular spine. Here you can see the scapular spine. It is present at the middle of the lateral surface, and hence the ratio of the supraspinous and infraspinous fossa, it is 1:1. The second point here, the anterior border and the dorsal border, both they are convex, and the posterior border it is thick and it is nearly straight. Another important point here, it is the cranial angle. In case of the scapula of dog, it is absent. This is the acromion process. The acromion process, it extends up to the level of the glenoid cavity, while as we see the scapula of the ox, this is the acromion process and this is the glenoid cavity. So this much is the difference between the acromion and the glenoid cavity. But here in case of the dog, the acromion process, it extends up to the glenoid cavity, and just you can see above the acromion process there is a curved palate present. This is the meta-acromion process. This is the meta-acromion process, and here the neck of the scapula, it is very much distinct, and posteriorly there is a tubercle present that is meant for the origin of the long head of the triceps muscle. Another important point is this is the glenoid cavity. The glenoid cavity, it extends up to the tuber scapulae. This is the tuber scapulae, which is blunt, and the glenoid cavity, it extends up to the tuber scapulae. And here coracoid process, this is the tuber scapulae, and the coracoid process here it is absent. So this was all about the scapula of the dog. One important feature, that the clavicle, it is generally absent, but when it is present, it is in the form of a small cartilaginous on a bony plate that is embedded in a muscle that is known as brachiocephalicus. So this is the left scapula. I have told you some important and differentiating points so that we can differentiate the scapula of the dog with the scapula of the ox. Thank you.